Hello everyone, I'm Dr. Rohan Khandelwal and I head the Department of Breast Diseases and Cancer Care at C.K. Birla Hospital, Gurgaon. You all might be aware that breast cancer is now the most common cancer all over the world. And in India, it is said that 1 in 25 Indian ladies would suffer from this disease during their lifetime. And the incidence is increasing fast. Now, I'm not going to deep dive into the risk factors of breast cancer, but what I want to discuss in this video are the symptoms of breast cancer, which you can pick up at an early stage and detect the disease early as well. So one thing which all of you should remember is that the most common symptom of breast cancer is a lump in the breast. Now, where ladies often get confused is that they think it should be a painful lump, but that is wrong. In most of the situations, initially the lump is painless, and that is why the cancer remains hidden for a long period of time. So my request to all ladies that do a breast self-examination every month. And in case you notice a lump which is persisting for one cycle, please don't ignore it and please visit a breast surgeon and get yourself evaluated. Breast cancers would cause pain only in the later stages. The other symptoms of breast cancer can be a discharge coming out from the nipple. Now here again, I want to tell you one thing, that the discharge we are concerned about is spontaneous discharge. By that I mean that you get up in the morning and your undergarment is stained or your gown is stained, or you come back from an exercise and your undergarment is stained with blood or clear discharge. That is the discharge which we are worried about, not the discharge which you get if you squeeze the nipple and you get a few drops. Amongst the various discharges, getting a clear discharge or bloody discharge is more concerning for us, and in case that is happening, please get yourself evaluated. Now, another very common symptom is the nipple going inside, and this is useful in those ladies where the nipple was initially outside and in the last few months or weeks it has gone inside or retracted. Some ladies can have retracted nipples since birth. For them, this is not a concerning sign, but if there's a recent retraction of nipple, then you should be concerned. Another symptom is thickening of the skin. If the skin becomes thickened and you have dimples on it and it looks like an orange peel, then that is also a concerning sign for us. Some ladies can notice lumps in the underarm region. These are basically lymph nodes, which are protective organs which prevent the spread of cancer to the rest of the body. So sometimes these lymph nodes can get enlarged, and if you notice these swellings, you should consult your doctor. A recent change in size or shape of one of the breasts. So sometimes we get ladies who say that the breast is becoming bigger or it is moving upwards, right? It's becoming smaller. And those are also signs of an underlying cancer which can be there. Rarely, sometimes you can get itchiness over the nipple and the nipple can become eroded completely, right? You can have an oozy nipple, and if this is occurring only on one side, it is more concerning for us. Sometimes you can get itching in both the breasts, and that is usually because of a skin condition known as eczema. But if it is happening on one side, it is of concern and you should get yourself evaluated in that situation as well. So these are some of the common signs and symptoms you should be aware of. And just 3 healthy tips to detect breast cancer early. Number 1, do a regular breast self-examination. This should be done once a month, preferably when you're in the shower. You should keep your hand above your head, put soap on your hand, and then feel for the breast. Never press the breast like this because you'll always feel a lump. You should feel against the chest wall. Once a year after 30 to 35 years of age, get yourself evaluated by your gynecologist or a breast surgeon. And if you've hit 40, then every year get a mammogram or an ultrasound as your clinician recommends of the breast done as well. So if you do this regular examination and if you're aware of these symptoms, you can pick up breast cancer early. And if you pick up breast cancer early, the survival is better, we can save the breast, and in a certain subgroup of patients, even chemotherapy can be avoided. So a humble request to all of you listening to this video, that if you have picked up 2 or 3 key points from this video, please do share it with 2 other ladies, at least one relative and a domestic help, so that we can spread awareness regarding breast cancer.
If you found this video helpful, Don't forget to give it a thumbs up and share it with your friends and leave your thoughts in the comments below. And of course, subscribe for more content on health and lifestyle.